We're going to be talking a little bit about Medicare basics today. We're going to talk about the four parts that really make up Medicare. There's Medicare Part A. It covers inpatient hospital stays. You have to actually be checked in, so emergency room is not a Part A coverage. Outpatient surgeries are not a Part A coverage. And observation, sometimes you might be in the hospital for 3 days and think you're checked into the hospital, but now, under the new laws and so forth, you may be being observed to see if you need to be checked into the hospital. So those things are not covered under Part A, they're covered under Part B, and we'll talk about those. But Medicare Part A then covers inpatient hospital stays. It covers skilled nursing, you getting better after a surgery or some type of thing. One of the Medicare laws is you have to have a 3-day hospital stay checked into the hospital to qualify for this benefit. And then they would pay up to 100 days. The first 20 they'll pay in full, and then you pay quite a bit. You pay a fairly large dollar amount after that. I think it's like $160, somewhere around there per day for that type of coverage. And then the other coverage it covers is hospice, so end-of-life type things. Medicare Part B covers everything else. Emergency room, outpatient surgeries, doctor's office visits, durable medical equipment, lab work, MRIs, CAT scans when you're not checked into the hospital. All of those types of things, ambulance, all of those things are covered under Medicare Part B. Medicare Part B costs about $122 for most people now. Some of you who have already been on Medicare for a while are not paying quite that much. You might be paying $105 for Medicare Part B. So then they have another thing that they introduced in 2006 called Medicare Part C. You probably see a lot of advertisement on that. It's with private insurance carriers. They actually become Medicare for you. The government disenrolls you from their Medicare rolls. They then send a bunch of money over to the insurance carrier plus what you pay for that to become Medicare for you. And then Medicare Part D, there was a lot of pressure brought to bear because prescriptions are really costly and so forth, and so there was no coverage at all for prescription coverage until 2006, and they introduced Medicare Part D. It has gotten better from when it originally started and so forth. All of you have probably heard about the donut hole coverage gap. It's really kind of a confusing issue, so we'd spend a lot of more time on a personal basis kind of going over those types of things. So that's the basics of Medicare, and so if you want to know more, we can go in more depth and in detail. You just have to call our office and come in and come in for an appointment. We would really suggest that you learn about these types of things about a year before you're going to actually get there, so you make some good sound decisions and choices. We have people do make mistakes and so forth, and it costs them. So we just look forward to having you give our office a call and scheduling that time. It's just a free consultation that we do. So look forward to seeing you in the future. Thanks.